Très bien. Bonjour. Je crois que nous sommes connectés. Madame l'ambassadrice pour la santé mondiale, chère Stéphanie Sédou, Madame Runa Khan, Madame Simon, coprésidente de cette belle initiative, Monsieur Miribel, Mesdames et Messieurs les experts, Mesdames et Messieurs qui êtes, je crois, partout dans le monde, nos auditeurs et participants en ligne de cette manifestation, je vous souhaite la bienvenue. Il y a un an, le 26 octobre 2020, je me trouvais ici même en compagnie numérique du professeur Ganten et de Benoît Miribel pour assister à la signature du protocole d'accord entre le World Health Summit et la Fondation française Une santé durable pour tous. De cet accord est née la démarche One Sustainable Health Forum, donnant une nouvelle impulsion opérationnelle à une approche intégrée et globale de la santé. C'est donc avec une grande satisfaction que je vous retrouve aujourd'hui dans une assemblée un peu plus grande à Berlin et pour toutes celles et ceux qui sont en ligne et qui n'ont pas pu faire le déplacement et bien partout dans le monde pour ouvrir cette table ronde Innovative One Health Policy and Government for Pandemic Prevention à l'occasion du sommet mondial de la santé de Berlin qui sera ouvert dans quelques heures. Ce panel nous invite à revenir sur les 2 années écoulées pour en tirer les leçons nécessaires à la prévention et à l'anticipation des pandémies futures. La situation sanitaire actuelle est toujours marquée dans le monde entier par cette pandémie de Covid-19. Toutefois, bien que le virus n'ait pas disparu, nous pouvons, je crois, nous montrer un peu plus optimistes pour l'avenir. Alors, qu'a permis cette pandémie? D'abord, un constat, celui d'une déstabilisation du monde entier du fait de cette pandémie. Deuxièmement, l'analyse nous a permis de voir à quel point l'interdépendance était forte entre les espaces, les acteurs, les écosystèmes dans lesquels nous évoluons. Et puis, je dirais, elle nous a permis aussi d'aller très vite vers des solutions. Et la solution, c'est la nécessité d'une approche globale de la santé mondiale et d'un renforcement de son architecture avec un travail commun des expertes et des experts du monde entier. Dans ce contexte, la démarche One Health prend évidemment tout son sens. Elle repose sur un principe simple selon lequel la protection de la santé de l'homme passe par celle de l'animal et de leurs interactions réciproques avec l'environnement. Cette approche globale est d'autant plus essentielle qu'aujourd'hui, 60% des maladies infectieuses humaines ont une origine animale. C'est pourquoi la France s'engage sur plusieurs terrains pour agir en amont des crises épidémiques et pandémiques. Elle ne le fait pas seule, elle le fait d'abord, bien sûr, avec ses partenaires allemands, mais ensemble, nous essayons d'agir de façon plus large. D'abord avec la création, lors du Forum de Paris sur la paix de l'année dernière, 2020, d'un panel d'experts de haut niveau intitulé Une seule santé, regroupant des experts sélectionnés par les 4 organisations internationales compétentes, l'Organisation mondiale de la santé, l'Organisation mondiale de la santé animale, l'Organisation des Nations unies pour l'alimentation et l'agriculture et le Programme des Nations unies pour l'environnement, qui se sont réunis pour la première fois en mai de cette année. Les recommandations de ce panel chargé de regrouper, d'analyser, de mettre en valeur les informations scientifiques sur les liens entre santé humaine, animale et environnementale permettront d'éclairer les citoyens comme les responsables publics. Le deuxième point, la deuxième initiative que je voudrais mentionner, c'est le lancement le 11 janvier dernier, lors du sommet One Planet Summit, de l'initiative Présode qui vise à prévenir les risques d'émergence zoonotique et de pandémie par la mise en place d'une veille mondiale. Cette initiative, qui combinera projets de recherche et actions opérationnelles, mettra en œuvre les recommandations du panel d'experts que je viens de citer. Elle rassemble déjà plus de 50 pays et institutions internationales et témoigne ainsi de l'intérêt grandissant pour cette approche One Health. Je remercie donc très chaleureusement Mesdames Runa Khan et Babette Simon d'avoir accepté aujourd'hui de présider la table ronde organisée par le One Sustainable Health Forum. Je remercie également les participants et participants à cette discussion le professeur Andrea Winkler, la professeure Francine Ntoumi, le docteur Benjamin Roche, Madame Christina Romanelli, le professeur Chris Walzer, ainsi que Benoît Miribel. Président de la République française s'est engagé personnellement pour la promotion et l'enracinement de cette stratégie One Health au sein des sociétés civiles et savantes à l'échelle nationale, européenne et internationale. C'est donc un sujet qui est suivi au plus haut niveau. Cet événement est l'occasion d'entendre, d'apprendre et surtout de faire émerger des idées nées de l'émulation de vos différentes expériences et expertises. Je suis sûre que cette table ronde contribuera au renforcement de cette vision One Health parmi les experts et les décideurs politiques du monde entier et débouchera sur des progrès très concrets pour l'avenir de notre santé. Je vous souhaite de très fructueux échanges. Merci.
Merci, Madame l'ambassadrice, pour votre accueil, pour ces mots qui rappellent effectivement l'engagement il y a un an ici dans votre ambassade avec vous, avec Stéphanie Sédou, ambassadrice Santé mondiale, et le professeur Detlef Ganten. Cet engagement qui nous amène aujourd'hui à être ensemble avec Présode, avec la commission du Lancet for One Health, avec le réseau Pandora, que dirige Francine Ntoumi, et aussi le Wildlife Conservation Society et Friendship. Tous ensemble, nous sommes là pour répondre à cette question. We are all together today, and thank you for being in connection with us. We are going to try to answer to that question. Does One Health could help to prevent pandemic? And so we will start with our two co-chairs. The first one is Professor Babette Simon. She is involved in the One Sustainable Health Forum since the beginning. And Babette, you were in charge of, you were the president of the University of Oldenburg. You are a member of the board of the governor of the Helmholtz Center for Ocean Research, GEOMAR. You are a professor at the Faculty of Health, Université de Paris, and a member of the expert advisory group of One Sustainable Health Forum.
Thank you, Benoit, for this kind introduction. I'm honored to have the opportunity today to co-chair with Runa this exciting session. The current COVID-19 pandemic has only given us a boost and shown that we need to think health globally, and that the health and well-being of humans, animals, plants, and the environment around the world are intrinsically connected. And nobody is safe until everybody in this world is safe and in a good shape. This is what we always have to bear in mind if we want to prevent future pandemics. We have to recognize that intact, functional, and resilient ecosystems provide the foundation for life, for health, and for well-being for all of us on this planet. And not only the risk of emerging or re-emerging infectious diseases or antimicrobial resistance, but also the current emergencies like biodiversity loss and climate change clearly illustrate that a transformation on our thinking is necessary based on interdependency and interconnectedness of the threats we are facing today. And this underscores that the One Sustainable Health approach is paramount. And we have to get to action. That's why we are here today. And one crucial question that concerns us today is how One Health policy and governance could prevent future pandemics. In other words, what do we need to operationalize one sustainable health and to integrate it into all policy areas. And Runa, my co-chair, will start in Bangladesh.
Thank you, Babette, and thank you, Benoit, and I'm really very honored to be here today. Thank you. So for the past 20 years, I've been working in the front line of some of the most vulnerable communities on the planet. Why am I sharing this experience? Because we have, in a way, found a system which seems to be working. Climate impacted migratory without access to basic services. These are the people that we've been working with. Our working field is in Bangladesh, which is facing submersion within decades, leaving 42 million people only in Bangladesh at risk by 2050. But high vulnerability and low capacity to adapt today impacts millions throughout the world. Human beings are same. Hunger, diseases, lack of opportunity, dignity, hope impacts everyone equally, as it does for the planet. Integration of every aspect of human health needs to be addressed, and that of the ecosystem that we live in. One solution doesn't work. Bangladesh, country of 148,000 square kilometer, delta of silt, 170 million people, 50% underwater. 20 years ago, visiting nomadic river islands, which are called the Chores on the Brahmaputra, I was the witness of families with really nothing. That's where we have to start. 18 families who had not eaten for 2 days, mother, whose child died of diarrhea because she did not have 5 euro cents to bring a child to a nearby hospital. They needed everything. And due to being in the bottom tier, we could not leave out the entire ecosystem in which they worked in. We tackled human health first. Unable to walk away, we pioneered the first ship hospitals in Bangladesh, because erosion washed away any non-mobile structures. But it was not enough. Even having a 3-tier health program, hospitals, clinics, community health, mHealth, we needed to ensure continuous, dependable services, which we take for granted. Respecting environment and respecting human rights as the linking thread, we created a dependable platform, saving lives through medical and relief works, poverty alleviation and climate actions through environmentally designed flood shelters, mangrove reforestation, restoring biodiversity, indigenous practices for agriculture, working with livestock, income generation through micro-social entrepreneurs. Empowerment by ensuring education and linking each impacted life to their socio-economic and political ecosystem. Every intervention was needed to create the platform for starting lives. Thus, 20 years ago, building a holistic system around human, animal healthcare, and the geography which it encompassed. We did not try to create silos of programs and projects, nor silos of needs and solutions. One cannot cure a child and let him die for lack of nutrition, nor help start financial activities without hope of education for their children, or by harming the environment for progress, which will not be sustainable or long-lasting, nor deworm children if they run barefoot on land where livestock is not dewormed. It remains incomplete, therefore inefficient in reaching the goals. Friendship services today are accessed by about 7 million people every year. Pandemic today, impending climate disaster tomorrow, wakes us up to the links between human, animal, and environmental health. One Health needs to be done in a sustainable, continuous way, incorporating sustainable, holistic, and realistic solutions. As COVID-19 has shown us, unless all the countries of the world and that one individual and that one life on this planet is safe, as Babette said, none of us are safe. Thank you.
Thank you, Runa. So you remember the link with both human and animal, and we have now Benjamin Roche from IRD, International for Research and Development Agency in France, and also PRESOD, which is a very important network to work on zoonose emerging diseases. So Benjamin, how do you see that how One Health approach could help to face to prevent the pandemic?
Yes, thank you, Benoit. So indeed, so first of all, I just want to add that so on the behalf of the President Initiative, we are very happy to co-organize this session with the One Sustainable Health Forum and all the different partners. And indeed, as Babette said, so the scientific evidence was accumulating since these last decades, but a lot of human activities are actually increasing the risk of zoonotic disease emergence, which could be through landscape change of landscape use, deforestation, intensive agriculture, or loss of biodiversity, just to name a few. So combined with an exponentially increasing worldwide connectivity, so the risk of zoonotic pandemic was considered very seriously by the scientific community and the international organization since decades. So this is what in 2018, the WHO called disease X. So this is probably what we are calling today the COVID-19. So we know that if we continue with business as usual, it's clear that COVID-19 pandemic won't be the last one. So it is therefore very crucial to be prepared to these threats. But it is also extremely important to articulate this preparedness plan with real prevention strategies. So really focusing on decreasing the human exposure to zoonotic pathogens. Very importantly, as Runa and Babette said, this effort has to be global and no area has to be neglected to this effort. So this is why the President of France, Emmanuel Macron, has launched the President Initiative during the last One Planet Summit in last January. So the overall ambition of this initiative is to be able to develop strategies to prevent zoonotic disease emergence. So we have two specific priorities. So the first one is really to improve the One Health epidemiological surveillance through the world in order to detect and respond as quickly as possible when a new zoonotic pathogen is spilling over to human population. So the second priority is really to develop new, innovative, integrated, and sustainable strategies of socio-ecosystem management in order to make them more resilient to zoonotic disease emergence. So this initiative is really, so it was the two main priorities, but this initiative is relying on science and will work on filling the different research gaps that we have identified in order to develop science-based solutions. In addition, this initiative also aims to make a clear difference on the field. So to this extent, it is clear that developing such prevention strategies will encounter some trade-off between socioeconomic activities, reduction of zoonotic risk emergence, and also has to ensure food safety. So in order to consider all these different interactions between all these different actors, so we have developed a co-construction approach since the beginning of this initiative. So we have developed a co-construction workshop across 11 regions in the world that has gathered more than 1,000 participants in more than 100 countries. So by doing this kind of co-construction approach, all the actors are a part of the solution, which makes this different solution being more understood, more accepted, and then can be implemented on a long term on the field. So in addition of all the participants of this co-construction approach, PRESOD is also gathering a large institutional and governmental support. 5 governments have already joined this initiative, and more than 60 research and health institutes have also joined this initiative. We have also a permanent discussion with all the other One Health initiative in order to be sure that we are not doing any kind of detrimental overlap. So we have especially developed discussion about data interoperability, which seems very technical, but which is actually a very critical point in order to be able to share different kind of data on health, human health, animal health, and environmental health. And actually, we think that this is a key recommendation for One Health policy and governance. We have to rely on a constant dialogue between academic research and the needs expressed by our societies. So the COVID-19 pandemic taught us that this dialogue between science and society is a really key element to avoid and control the different sanitary crises. Moreover, developing such dialogue will also help synchronizing the different agendas between the most important threats for humanity, biodiversity loss, climate change, and so pandemic emergence. This is through facilitating these synergies between all the ongoing program and all the different actors involved in this issue that we will be able to better understand these interactions between human, animal, and environmental health, and to reach our common goal, which is to prevent the next disease X. Thank you.
Thank you, Benjamin. And now I would like to hear Andrea Winkler. You are a professor of global health at the Munich University, and you are co-chair of the Lancet One Health Commission. So you are working, and we see that the One Health, planetary health, are moving a lot internationally since especially we had to face the lockdown. So can you give us your point of view about how One Health could help to prevent pandemic, and maybe a few words about the pandemic treaty, because we speak about it recently.
Thank you very much, Benoit, and thanks overall to the One Sustainable Health Forum for making this possible, and also to the French Embassy, who is hosting us so nicely, and of course to the co-chairs and all the panelists here. I'm very proud to be part of that panel, and also very proud to be part of the initiative. I'm representing the Lancet One Health Commission, as you already very nicely introduced, Benoit. So the Lancet One Health Commission is a very well-known, I think to most people, science commission that will issue a report that provides an evidence synthesis of the added value of the One Health approach. But we will also identify avenues how we will be able to implement, or how people, governance, states, and globally, we should be able to implement One Health. And very important is a systems approach and systems thinking. So that's number one. And of course, good One Health governance, policy translation, leadership is important. We have to rethink One Health economics. I think that is crucial. And then One Health knowledge sharing, not just in the universities, but already starting at schools, primary schools, and going beyond vocational training, and also people that are already established, not the least politicians. So shortcomings, we feel that shortcomings in local and also national global governance are recognized as a key driver of emergence and reemergence of diseases of the animal origin. The two co-chairs, so that's myself together with John Amwesi and other commissioners, together with key stakeholders from the Global One Health Network. It's a policy network from Canada. We recommend a prospective pandemic treaty with an integrated One Health approach to be able to harness good governance around the pandemic issue. And I just make 3 points why we think that is important. By harnessing multi-sectoral coordination, a One Health informed pandemic treaty can actually complement and enhance the connectivity of already established agreements and treaties, but at the same time advance pandemic prevention preparedness, as well as human, animal, and environmental health more broadly, and generate significant cost savings. Such a proactive One Health approach must address the inherent limitations of the international health regulations, that's for sure, but also other existing treaties and relevant human, animal, environmental agreements, challenges associated with the regulation of animal health, including the respect of wildlife trafficking markets, and also barriers to other issues, barriers to effective legislation with regards to antimicrobial resistance, food safety, land use and biodiversity, and other policy issues that will be crucial to the prevention of the next pandemic. How should we do this, and what should be core in such a treaty? I think that's important also to think through. We feel that such a treaty would be a powerful opportunity to incentivize the establishment of a One Health infrastructure, including integrated One Health surveillance systems, as Benjamin has just mentioned from PRISOD, to build mandatory One Health capacity for pandemic preparedness monitoring, ideally by using an inter-transdisciplinary One Health evaluation framework, and maybe even developing some metrics that through which we could measure One Health successes. We don't have those metrics. I think it's very important to really start thinking about them. And establish a dedicated One Health governance body to oversee, provide technical scientific support, and not the least, to integrate but legally binding financial and technical support mechanisms to ensure global solidarity and equitable allocation of resources. This sounds a lot, but we would like to emphasize that such a pandemic treaty for sure would run in parallel to other treaties, agreements that have already been established. So we are not suggesting to reinvent the wheel, but to work together and to establish a sort of broader approach and connect what is already there, but at the same time think into the future and fill the gaps that have not been filled so far. Thank you very much.
Thank you, Andrea. So now we are going to move to Chris. Chris, you are the Director of Health at the Wildlife Conservation Society in New York. You are also a board-certified wildlife veterinarian and Professor of Conservation Medicine at the University of Veterinary Medicine in Vienna, Austria. So I think that now we are reaching a different point about especially the surveillance that was mentioned and what kind of rules we need to establish. And so we are very pleased to have you with us because we are talking about human, animal health, but we know also we have to include the environment. So before opening a Glasgow conference, it's very good also to have you with us today. And I know that Runa, you will go also in Glasgow very soon.
Does it work? No. Thank you. Thank you very much, Benoit, for the introduction. Thanks very much for hosting this this meeting here, this panel here today in the French Embassy. It's a great pleasure to be back in Berlin. There's a lot of history of the Wildlife Conservation Society and its engagement in One Health, because it was in 2019, just a few months before the outbreak of this pandemic, that Andrea and several others, we met here in Berlin to develop an update of the so-called Manhattan Principles of One Health. And in 2019, we did that here in the city. And I also want to thank Professor Gunton, who generously let us present it at the 2019 World Health Summit. So really 2 months before the pandemic was very, as if we knew what was going to happen. And Benoit has already pointed out, disease X has been around, so none of this should have been a surprise for us. So let me just build a bit on what my colleagues have said here on the panel already. So one of the things, WCS, the Wildlife Conservation Society, has spent about the last 20 years working on the front lines of spillover. That's inherent to the work we do. We work deep on these front lines of conservation, and these are places where infectious diseases also spill over. And I also, right at the beginning, want to make one thing clear. We're talking about One Health, but we're under this really effect of the pandemic at the moment. So we keep talking about infectious diseases. There's a lot of reasons to talk about One Health and not address infectious disease. There's a lot more to it. But obviously, at the moment, we're really driven by the ongoing events. So as everyone has said, we appreciate and we all recognize the interlinkages of animal, plant, human health, and so on. One of the other things, though, we have to also consider, there are 4 global crises we're facing at the moment. And that's climate change, biodiversity loss, global inequities, and then also this public health crises. But the thing is, all these crises are interlinked, tightly interlinked. And the solutions for one of them also benefits the other. So we always have to think in co-benefits. This is really important, and that helps us also cut the costs. And I will try to make some comments on costs. As Runa had already pointed out, all economic and social development depends on a healthy environment, and which in turn depends on biological diversity. Without diversity, your ecosystems are not going to function. They won't provide you the services you need. So we have to always keep that central in our thoughts. I've been teaching One Health or conservation medicine for nearly 2 decades now, and I'm really embarrassed at the time of some of the things I did 20 years ago. It's terrible. And the worst are the 3 circles. The 3 circles of One Health. I'm embarrassed. Generations of students had to go through this. And it shouldn't be that way. What we should have is a big foundation. The basis should be the environment, the functioning environment, and health will build on top of that. And if you think of the SDG wedding cake idea, that's the way One Health has to work, right? Well, you learn, you know, that's the thing. So let me see, what do we have to do next? Obviously, operationalizing One Health, there's a lot to that. First of all, how do we operationalize? We've talked about this for decades. We don't know. But as Andrea said, we need to build strong institutionals that integrate the understanding of human, animal health, and the health of the environment. They need to be integrated. At the moment, we have the tripartite plus, but it's inherently already 4 silos. They have 4 different funding streams. They are not able to completely cooperate because the funding streams are already that way. So that's something you have to think about. Then the most important thing as we talk about disease X, it's not like we didn't know this pandemic was going to happen. We knew it was going to happen. But obviously scientists are really rubbish at communicating. So what we need to do, we need to be better at translating the knowledge, translate that knowledge base and communicate it so that policymakers and decision makers can actually use it to take decisions. So this is I think one of the other things. And then there's some really specific things we can do in respect to the infectious disease and pandemic. Now, we know and we've heard already that these infectious diseases, the novel pathogens, originate in wildlife. They come from wildlife. So there's some things that we've got to just stop doing right now. Deforestation, land conversion, we can't afford to do that anymore. And not only the forest that we cut down brings out, you know, we always say it shakes out the pathogens, but we also need it for mitigation of climate change. Remember, 30% of climate change can be mitigated by nature-based solutions in the forest. So why not stop cutting down the forest? You need the forest for water and clean water access and so on and so on. Let's stop that. Just stop it. And even worse, let's stop the perverse incentives to cut down that forest. I mean, we're talking about a lot of money. The second thing is we humans are just extraordinarily good at creating new interfaces. I mean, some of the stuff we do, the trade of legal and illegal wildlife and markets where we bring live animals together, mammals, birds, hundreds of species, and then we add in thousands of people and we bring in domestic livestock and poultry and we let them all, sorry for being quite blunt, but we let them poop on each other and then we also go and slaughter things there. That's a really good way to breed new viruses. We provide the conditions for them to recombine and we'll get the next coronavirus, the next paramyxovirus and so on. That needs to stop. And the return on investment to stop that is gigantic. So talking about money, and this always amuses me the most, is when I say, there's been a lot of models now. And when we talk about pandemic prevention, we need two sides. We need to have the preparedness, and we're all focused on preparedness now because we're still under the shock. Like I was in New York at the time. Gosh, we don't have face masks, so we're just going to put a piece of cloth in our face. That seems outrageous. But we need to also talk about prevention at source. And if we're going to talk about prevention at source, the number that's been portrayed has been $10 billion. If I told you in 2018, One Health needs $10 billion every year for the next 10 years, you would have all fallen out of your chairs laughing. Remember, that sum is going to be less than 1% of the costs that this pandemic has caused. So we need to start investing serious money and we need to change our economic systems. And I think we need to do it right now. There's no time to wait. Thank you.
Thank you, Chris. Clear. It seems that on one side we need to think One Health without any borders, but we need also to respect the natural borders. When we go into a deep cave looking for bats, it could be very dangerous. You see what I mean? So Francine, we are very happy to have you today with us. Professor Francine Ntoumi, you are the president of the Congolese Foundation for Medical Research and professor at the Institute for Tropical Medicine, University of Tübingen. And you are the coordinator of the Pan-African Consortium Pandora, which is involved for years in One Health. Can you give us did Chris, some of recommendation that due to your experience?
Okay, thank you very much, Benoit, and good afternoon, everyone, and thank you, Excellencies, for welcoming us at the French Embassy. So, yes, I'm the coordinator of the Pandora Network, and Pandora is one of the few One Health network consortium in Africa. It involves 4 European countries and 8 African countries. And these 8 African countries are distributed in the 4 African regions, East, West, Central, and South, and 22 partner institutions. So the principal aim of this Pandora network is to strengthen health research capacities and system in Africa for the preparedness and a rapid response to infectious disease outbreaks arising within or from Africa. And this Pandora network has been established in 2017, not so 4 years, about 4 years. And so far we have conducted training, established a strong training platform, not only for health workers and for students, but also for ethics committees. So for assisting them to really evaluate proposal during emergency situations, and also for regulatory authorities in collaboration with AVAREF, WHO, AFRO, and Africa CDC. And of course, we have conducted epidemiological investigation in human and animals for Lassa fever, Ebola, chikungunya, dengue, and of course for COVID-19 infection. But most importantly, also, we are trying to work closely with the community, to have community engagement. That's very important to explain what we are doing, why we are doing that. However, we have faced many challenges. And I would say the first challenges is that in Africa, most of the studies are conducted in town, in main cities, and we forget about rural health workers. So we need really to address this issue. As mentioned, everyone has to be involved in this One Health activity. The second challenge is non-integration of disease surveillance programs focusing on human livestock, wildlife, and ecosystems. We have health program, health department, and human human department, and no communication between these departments. So that's also a big issue. And we also do not enough poor involvement of social anthropologists in our investigations. And the last one, highlighted with the COVID-19 pandemic, logistic issues. Difficulty for purchasing and reagents and lab equipment. So infrastructure have been and remains a very key issue. So as a recommendation as asked by Benoit, I would say the first one is really to have in Africa local ownership of One Health. At the moment, it appears like it's, a northern, discussion, but we need to have this discussion, local ownership. The second, as mentioned by Benoit and Benjamin as well, to have more financial support for this One Health activity and political commitment. The third one is for, as mentioned also by Benjamin, for long-term sustainability of our effort, we really need to have the community, to to avoid this overlapping of all these initiatives, to have a better coordination on the ground of who is doing what for avoiding, duplication and waste of so few resources. So that would be the recommendation based on Pandora experience.
Thank you, Francine, and that's very clear and helpful, because at the end of the session, we'll summarize our recommendation and also to underline the options or the issues that we still have to work on it. And so we should have now Cristina Romanelli from WHO. It should be through the WHS video conference. Do you hear us?
Yes, I hear you perfectly. Thank you. Do you hear me? Can you hear me?
Okay. Yes.
Brilliant. Thank you.
Thank you, Cristina.
So shall I just go ahead?
Yes.
Thank you so much for the invitation to the panel and for this really brilliant opportunity to engage with you all and share a few key developments and perspectives of WHO's ongoing work on One Health. I think that the really compelling group of speakers that have preceded me just now have beautifully set the scene on the value and importance of One Health in a post-pandemic world, making clear that One Health is not only an essential part of a healthy, green, and just recovery from the COVID-19 pandemic, but really a foundational building block in the road to disease prevention. So as the other panelists have noted, the COVID-19 pandemic has placed a spotlight on the delicate nexus between health and nature, and it really has, I believe, intensified our collective global voices calling for transformative change that is supported by more integrated, coherent, ambitious investments for pandemic prevention that in ways that actually meaningfully bring together the full range of evidence and experiences across our different sectors and disciplines. And I think that we can safely say that COVID-19 is only one of, in fact, I believe it was Chris that also said, this is only one of many striking examples of our collective, I suppose we can call it systemic failure to make the connection between the natural world, wildlife, livestock, and our political and socioeconomic and financial structures. So at WHO, we have been very vocal advocates of this holistic vision of health, recognizing it as a challenge, of course, but also most importantly, as an opportunity and an imperative. So I think one of the things I would like to do is talk about a few developments that we've had at WHO. What are some of the ways in which we're helping to promote this more integrated, holistic vision of One Health, and to mention a few key recommendations. So how have we done so? Well, essentially, we have pioneered holistic approaches such as One Health for well over a decade, and have a very long and expanding history of collaboration with partners such as yourselves to support countries in the implementation of One Health. And many lessons have really been learned over the years, including for the need for a more inclusive and integrated vision of One Health, which to this day is still lacking. So we've recently doubled our efforts to ensure that that vision is more inclusive, and that the full range of environmental and social determinants of health, which have long been sidelined from the implementation of One Health efforts, are brought together in a truly holistic One Health vision, one that actually meaningfully encompasses both infectious and non-communicable diseases, and that enables us to support prevention by catalyzing the political will to invest in equitable health promoting environments. So what are those? Those are essentially environments that harness the full potential of healthy ecosystems to ensure that we have access to clean air, to fresh water, to healthy urban environments, to healthy, sustainable diets, and importantly also to environments that enable us to regulate the climate, mitigate disaster risk, and collectively really get to the root of those common drivers of biodiversity, climate change, inequity, and disease risk. So there have been some examples of innovative One Health mechanisms that have been presented here, including, for example, Présode that Benjamin mentioned. And I think that ultimately, we need mechanisms that meaningfully consider the synergies and trade-offs between the actions that can be carried out by different sectors in an effort to maximize those co-benefits for human, animal, plant, and ecosystem health, and mechanisms that meaningfully also support biodiversity conservation and climate change mitigation. Many times, one of these dimensions, if not both, is actually excluded from that. So we really need to come to the realization that we have to invest in innovative One Health financing, policy and governance mechanisms that really enable us to get to those root causes of health risks through that systems lens that was mentioned earlier as well. So I'm going to mention them very briefly, but as a testament to its commitment, WHO has been really doubling down on its efforts to be bold and think outside these silos through these more integrated One Health approaches. As a first example, WHO launched a comprehensive manifesto for a healthy, green and just recovery that last year that calls on all stakeholders to prioritize environmental protection and climate and prepare and reduce our vulnerability to possible future emergencies. So if there is the opportunity to do so after this roundtable, a few of these initiatives that I'm mentioning now, I would like to provide links to as well. There was also the recent expansion of our tripartite alliance, the alliance between WHO, the Food and Agriculture Organization, the Organization for Animal Health, to include the United Nations Environment Program, so as to more meaningfully bring in those environmental and social determinants that we were talking about earlier that have long been lacking in the implementation of One Health. There's also been the establishment of the high-level expert panel on One Health, which was mentioned briefly in the introductory remarks, as well as the lesser known but equally important establishment of an expert working group on biodiversity, climate, One Health, and nature-based solutions, with whom we're currently in the process of developing an operational framework on biodiversity and health in an effort to really catalyze health and cross-sectoral leadership for One Health. With the Tripartite Plus, which now also includes UN Environment, we are also working to develop through the Tripartite a global plan of action on One Health that is inclusive. One of the speakers earlier mentioned the preparation of a global treaty on pandemic preparedness, which is also going to be presented at a special session later this year in November. So really important to ensure that prevention is well embedded in there as well. We've also become implementing partners of initiatives that we wouldn't normally have worked with, such as the UN Decade on Ecosystem Restoration. And as some of the speakers mentioned before, we also have critically important opportunities that are coming up, including the Climate COP at the end of this week, the Biodiversity COP next year, in which we can all contribute to driving a more ambitious commitment and investments in One Health. So just one more example, I promise, because I know these are too many already. At the end of this week, in advance of the COP26, we've also launched a new special report on making the health argument for Climate Action, which essentially proposes a set of priority actions from the global health community to governments and to policymakers and to stakeholders around the world, including all of you, for urgent action to really address the concurrent health, climate, and nature crises as a way to safeguard our collective health. So what is it that we need now? A few elements would, I mean, amongst the many amazing examples that have already been provided, a few additional elements is that we really need to focus from governance systems and investments that are largely focused on emergency response, which indeed are infinitely more costly, as was mentioned by Chris, I believe, to systems that are focused on prevention and preparedness. And One Health is really so essential to this effort because it really has the potential to provide us with the essential building blocks to avert our collective health risks. Other key elements of that have been mentioned by Francine. Meaningfully engaging with local communities and with those on the front lines of natural resource management in the co-development and co-design of One Health responses through the creation of strategic partnerships with frontline workers, by engaging with local communities and by strengthening, I believe other speakers have also spoken to strengthening wildlife monitoring and surveillance systems, empowering all levels of governance. We talk very much about the local, but it is true that we also need that strategic leadership at the global level. So there really needs to be communication and connectivity across and between. By transforming our traditional ways of thinking and of doing business in ways that catalyze behavior change, we forget that we really need to bring in those social determinants sometimes. That behavior change is essential to the meaningful implementation of One Health approaches. And how do we do that? We do that through whole of government, whole of society, One Health policies, plans, and actions. By driving more coherent, coordinated ways of developing policies, whether it be across environment, fisheries, forestry, health, urban planning. So it's not just, the human-animal interface, but really bringing all those stakeholders together. And I'll leave it there for now. Thank you so much.
That was very clear. So now we are reaching the end of our sessions. And so I will leave the floor to Professor Bebet-Simon and Runa Khan for a few minutes, and then it will be the closing by Ambassador Stéphanie Sédou.
Yeah, thank you very much for these inspiring presentations. I think you tried to give an answer to operationalize the One Sustainable Health approach in the context of a pandemic. And I will try to make a summary. It's not so easy. I think I make 7 points. First of all, we need an innovative One Health policy and governance. And the second point is, I think central to the One Health approach is the principle of solid collaboration in an interdisciplinary and cross-sectional way, internationally, nationally, regionally, locally, within networks of networks. I think that's a very important point. Third point is we need the development of prevention strategies with an effort on pandemic preparedness. And important, I think it was mentioned from several panelists, strategies of socio-ecosystem management as a systemic approach. Fourth point is a very straightforward and novel proposal Andrea made is the prospective pandemic treaty with an integrated One Health approach that could enhance connectivity and would incorporate One Health in pandemic prevention and preparedness, in monitoring and surveillance system, in economics, financing, and knowledge sharing. And the dedicated One Health governing body is a quite strong tool. Fifth is, you remembered that we have also to look locally and invest in infrastructure. And Chris, I think he made the special point that we have also go back to the roots. And we need to stop exploitive and destructive practices. And the second point you made, which is very important, the development of strong cross-sectional institutions, which do good research for translation into policy and practice. I think that is very important. And to summarize, I think there is need to step up prevention and preparedness through an integrative approach. One Health is there the key. And we have to invest into infrastructure, because if we don't do anything, it's going to be very expensive. And thank you very much. I hope I tried to get that summarized, what you wanted to answer, give as an answer.
Thank you.
Thank you.
Thank you, Babette, for this clear recommendation. One point, maybe very short, Runa. It's about local communities that you know very well in the country. It was a point also from Francine. Just one recommendation about how to involve the local communities.
Thank you very much. Very, very inspirational, and we really have, I think, today found kind of a way forward. Now the thing is to take to actions. So I don't want to go into the why we have to do it. I think by now we all know why, but this needs to be accepted as a policy. This question of integration of health, of human, animal, environment. And this is beyond only the pandemic today, Chris, as you very rightly said, and what I've been doing for 20 years. It is basic. It is basic as for poverty, for for integrity, for human rights. We need to work together. We need to work in solidarity. I think all of us have said this in many different ways. And create a respectful platform, of the different actors. If we don't do it respectfully, then it's very difficult to actually go into implementation. Be it the civil society, the decision makers, the scientists and implementers, all working together. And I would say the media. Even they need to be voices, like Greta. We need all of them at different times, but all of them need to be there, and we need to treat each other respectfully in doing it. And the solidarity of work not to be done in silos. This kind of a cross-sectoral, but have a kind of a cross-sectoral partnership. And it has to be done at different level, each level being as important. The decision makers have a certain responsibility linked to the implementers right from the community, because if it doesn't work at the community level, as you very rightly said, Francis, it doesn't work at the community level, it's extremely difficult to raise it and to actually have the difference that we want in this world. So it has to start there, reach the decision makers. And I think this process of doing it together is very important. And actions, of course, are needed. We need to start today so as not to miss the chance of using the pandemic as a very solid goal pathway. And certainly in the end, I would say the planet belongs to everybody. And unless this is done, the animals, this is like ethics. Unless we respect each of our different areas of work, it is going to be, the plants, the environment and us, we all need to work with respect and solidarity. And I really hope that we could have a manifesto at the end of this, and so that we could link it all together and work efficiently. Thank you.
Thank you very much, Runa. So now the time for Stéphanie Sédou, French Ambassador for Global Health. I will also thank Professor Detlef Ganten, of course, Professor Jean-Paul Moati, who is involved since the beginning in the One Sustainable Health approach, and the Dean of Paris University, Xavier Jeune-Maître, with us, and all the invitees here.
Un grand merci, Benoît, and really thank you to all the very inspiring interventions. Je vais continuer en français en tant que ambassadrice pour la santé mondiale. Un grand merci à l'ambassadrice Anne-Marie Descotes pour son accueil. Je serai assez brève pour rappeler le soutien de la France à l'initiative et à la démarche Une seule santé. Comme l'a bien dit Anne-Marie Descotes en ouverture, c'est une approche que la France pratique depuis pratiquement de 2012. Enfin, en tout cas, c'est un concept qui nous est familier. Comme nous l'avons dit également, des initiatives assez récentes comme le panel d'experts de haut niveau qui a l'ambition de faire justement ce lien entre la science et la décision politique dont vous parliez a été installée et désormais opérationnelle. Également Présode, dont il a été beaucoup question, et je ne vais pas répéter tout ce qui a été dit. Mais je suis frappée d'avoir, à l'issue de ce panel, entendu tellement de choses concrètes en réalité, et c'est ça qui a retenu, je pense, peut retenir l'attention à l'issue de cette heure de débat. Vous avez tous une très forte expertise, elle est variée, et vous avez réussi à apporter en 1 heure à peine un grand nombre de propositions que vous avez très bien synthétisées, mesdames. Je trouve que c'est la valeur ajoutée claire de cette démarche One Sustainable Health Forum. Je pense que c'est important de voir qu'on arrive à faire ce lien entre toutes les dimensions. Je ne vais pas répéter ce qui a déjà été dit, le global, le très local, le scientifique et le plus pratique, le politique et le technique. Bon, mais je pense qu'on tient là quelque chose qui peut véritablement continuer d'alimenter de manière très intéressante les démarches qui sont, par exemple, conduites au sein de ce World Health Summit qui nous réunit aujourd'hui. Et c'est l'occasion pour moi de vraiment rendre hommage au professeur Detlef Ganten qui a tout de suite eu l'intuition de l'intérêt de cette démarche et qui a été bien suivi par le docteur Pris et qui a tout à fait, le professeur Pris qui a tout à fait endossé également la démarche. Moi, ce que j'aimerais retenir peut-être en dernier mot, c'est ce que vous avez dit, Runa, vous avez dit, c'est One Health, mais not One Solution. Et je pense que ça résume bien le fait que le travail est vraiment devant pour trouver toutes les bonnes solutions, mais avec un seul cerveau. Enfin, c'est vraiment, c'est One Health, One Brain. Il faut vraiment arriver à mettre toutes ces dimensions-là dans le cerveau, dans une même, comment dire, à tout moment, et démultiplier ensuite dans toutes les solutions nécessaires sur le terrain. Je forme le vœu que cette démarche si concrète et qui a réussi vraiment, je crois, à faire la synthèse de toute cette complexité finalement, mais aussi de toute cette dynamique, puisse continuer à être portée dans le cadre du World Health Summit. Je crois que c'est un peu l'idée pour les propositions qui pourront être faites par le forum à l'avenir. Et je vous assure en tout cas du plein soutien des autorités françaises pour continuer de soutenir une telle démarche. Un grand merci à tous. J'ai beaucoup appris en vous écoutant aujourd'hui et je crois que nous pouvons sortir avec un certain espoir malgré tout. Merci.
Merci beaucoup pour votre soutien. Je dirais, depuis le début de cette initiative, vous étiez là lorsque nous avons signé l'engagement avec Detlef Ganten. Merci à tous nos invités, nos speakers qui ont été remarquables. Présode qui est très présent dans le forum. Ce forum est une plateforme, je le rappelle, de différentes initiatives et nous avons réussi à mettre en avant des conclusions, des recommandations et des problèmes sur lesquels nous allons travailler. Je rappelle que I remind you that this platform will work and come back in 1 year, we hope, here to give you a recommendation for a manifesto. We will see the name of the work because we have several working groups working permanently for 1 year. I would like to thank the French ambassador who has to leave, but who will we will see her again for the opening ceremony of the World Summit later. So thank you for being here and all the people who are connecting with us. Thank you to the team here, to Christine Jacob, Nicolas Touard, and also to Kebi Abe. Thank you for your work. Thank you for Julia Fordier and Max Clarent from the OSH team. And to our translator, Jean-Luc, who started to know more and more about One Health. And thank you to all of you. And keep in touch through the website of all our initiatives. Thank you very much. Bye-bye.